However, I have a script for the session. So, are you ready for our pitch session? Yes. You sure? Okay. First up, we got you come in. You come in. Over here. You have 5 minutes.
All right.
So I'll let you know when I'm going to start, because I have a little tool called a clock, and it will be. All right, are we ready? Because you've got some helpers here who will ensure that you finish on time. 5 minutes is starting now.
Good afternoon, everyone. I know it's cold, but you need to give it a little bit of life. Good afternoon, everyone. Okay, so if you're passionate about cancer awareness, management, and prevention, you will answer like you have a bit more life, all right? Good afternoon, everyone. You guys have taken about 1 minute from my time, so you must clap for me. All right, esteemed stakeholders and visionary friends here, I'm honored to introduce what is called Motherly. First things first, my name is Ukeme. I am a health innovator and practitioner, a medical social worker at a master's level, and also a presenter on a television program called Health Digest on the local TV network AIT. So I'm going to go straight to it. I'm honored to introduce you to Motherly. It's an innovative AI-driven. I am trying to explain it to you, so you might want to just take a minute. Motherly, yes, mama, mom, ma, ni. All right. It's an innovative AI-driven WhatsApp technology designed to combat infant and maternal mortality, as well as promote cancer prevention in Nigeria. With Nigeria accounting for about 814 maternal deaths per 100,000 live births and 69 infant deaths per 1,000 live births. Motherly aims to bridge the gap in access to critical healthcare information. Nigeria faces significant challenges, as you know, with limited access to quality care. Did you know that only 36% of Nigerian women have access to skilled antenatal care? I know, very alarming. And 67% of newborns are not even registered. Additionally, they are often neglected due to lack of awareness and access to information. Motherly addresses these challenges by providing a platform for expectant mothers, new parents, and women who receive timely, accurate, and personalized information in a localized manner. So this cuts across, Pidgin, Igbo, Yoruba, wherever you are. And WhatsApp is a platform that literally everyone has access to. So it has that bottom-top approach which is needed. Now, Motherly uses the AI-powered WhatsApp technology, one, to give you tailored guidance on antenatal care, vaccination, postpartum care, and cancer prevention localized to the Nigerian healthcare guidelines and protocols. And with any information sharing, it's important to know that this is just a supplement to the information given by your healthcare practitioner. So you always have to work with your doctors. It is not a replacement. It gives critical healthcare alerts, timely reminders and notifications about important health milestones and cancer screenings. You also have a connection to peers and healthcare providers for emotional support. I know that because I'm a boy mom. I have a toddler who is 2. And despite the fact that I'm a people's person, I got to understand that as a mom and as a new mom, you need all the support you can because it is a total different ball game. Now, the program I present called Health Digest on AIT will feature interactions with medical practitioners and amplify the impact of Motherly for feedback, meaning people can, send in questions. Because I interview experts from different walks of life, they're able to get proper information from experts on this. It will address health issues, answering questions on maternal health, antenatal care, vaccination, postpartum care, and cancer prevention. I spoke to a very wise man who addressed the people I was interviewing as a victim, and he did say that one of the bases or the important factors when it comes to cancer care is addressing it from conception, and that's what this aims to do. I have 1 minute left, so if I sound like a rapper, please forgive me. The fact that I'm going to be incorporating it to the TV program will give it a broader reach, reaching the bottom-top approach that we want to do. Now, reducing maternal and infant health is by ensuring timely access to information, improved health outcomes, and enhanced user expertise. The opportunities for branding for this, because I mean, everything has to have an interest. The opportunities for branding and collaborations are very much available. You're highly welcome, sir. All right.
Just take a chair and then I'll press pause so she can continue. I can spare. Okay. Okay. Are we all seated? At the back. Are we seated? Okay.
Esteemed guests, ladies and gentlemen, for those of us that just joined us in the room, you're welcome to the pitch session for this event. My name is Ukemere Tukwa, and I am pitching an AI-driven WhatsApp technology that aims to prevent cancer right from conception. It is called Motherly, and it aims to give information to new mothers, postpartum care, and as well as cancer information. And I was told I have about a minute, even though the time was paused. Now, the partnerships opportunities for this are the collaborations to amplify the impact, partnering with relevant organizations to provide sponsored content and events, outreaches, and the likes of events like this, as we have the TV station I work with, AIT, in the background as a result of things like this. That is what a partnership will bring. And data analysis, providing valuable insights to healthcare organizations. This is one of the deficits of the health startups in Nigeria. They lack access to proper healthcare. Thank you so much. I invite you to join us in this mission by providing funding and support for Motherly, the AI-driven WhatsApp technology that will help prevent cancer. Thank you.
Thank you very much. Thank you very much. So, pitch one done. Going first is always hard, so congratulations. You've had some disturbance, the extra time, fantastic pitch, very clear, okay? So, remember there's a prize for this, goes in our newsletter. Two of the most successful pitches are going to go in our newsletter. So we're going to go on to our next pitcher. We're going to Isa Mohammed. Are you here? Wonderful. So, as before, in case you missed it before. Okay. Oh no, it's just, I won't start yet. So we're going to do this. We have 5 minutes. The audience have volunteered to clap you off at 5 minutes. Do not underestimate how loud they clap. You've just seen that just now. Okay, so when you're ready, let me know. And we're going to have a slide come up because we're not going to go without a slide. One slide, fantastic. I've done a lot of pitch competitions, as you probably guessed. We've done pitch competitions with people with 25 slides. Wonderful. Boo, get off. So I've also had pitch competitions where someone's come on and said, oh, I've got one slide, but they have one of those clever slides where the text moves around. Only Andy has made it into a PDF, so his text doesn't move. Oh dear, how sad, never mind. So, we have a slide. Is that your slide? Wonderful. I'm going to give you the microphone, and I'm going to press start for 5 minutes, and my audience will be thinking, is he going to be brave enough? Is he going to try and do the 5 minute thing? Your time will start.
Good afternoon, all. Thanks for having me. My name is Isa Mohammed. I'm a health system specialist. I work in development and humanitarian health programming. I'm here to introduce you to how we intend to create a sub-ecosystem in Nigeria. And this is how we want to do it. Our company is called Healthcare Access and Coverage for All. Very ambitious. The vision is to create an ecosystem that we have influence over, and we do not wait for partners or factors we do not control. So our entry point is health finance. He who pays the piper dictates the tune. Our entry point in health finance is enrollment into what is available through the NHIS. So we have a product ready. We call it Hacker Tech. Version 1 is ready. We've got hosting with Google Cloud for startups. We're in the process of integrating with Paystack. This is what it does. It's a platform where you have healthcare in your pocket. On your mobile phone, you can enroll under the gift ship program of NHIA. You have options for multiple HMOs, multiple coverage plans that HMOs have. You can choose gift ship if you want. seamless enrollment. Everything is done on your phone. Secure payment, like I said, we're in the process of integrating with Paystack currently. So the way you do your money point, your PayPal, your all those things. User account management. The explanation for this is there's something for everybody. The HMOs will have a backend, so they have access to whatever information is being uploaded. The service providers will have a backend, so they have access to whatever information is going up there. The health insurance agencies will have a backend, so they know what's going on. This simplifies enrollment. Currently, you register for a gift ship, it takes you, 6 months. You register even for the corporate formal programs, it takes at least 3 months. Ours is instant. Then there's an admin portal, like I've said, for HIS. This is version 1. We are good to go. Version 2, opportunity for diaspora proxy payments. People from abroad can pay through our portal, and they're fine. No, send me money for this. This person is sick. That person is sick. Batch group enrollments. Our philanthropists can enroll their family members, a whole neighborhood of IDPs. Then we want to employ AI for face or fraud detection. This is a current challenge the NHI is facing. Health insurance. It works for OPay, PayPal, native language option, chatbot customer support. If you've used AI, you know how helpful it can be. It anticipates what you want. Feedback and ratings. Now, we want to do claims management. One of the reasons why a lot of hospitals are reluctant to join some programs is because it takes a long time for them to get their money back. With all this data and everyone communicating together, claims management becomes easier. Now, like I said, this is our entry point into the ecosystem. When you have a whole network of service providers, of HMOs, and a client or patient can decide to change his HMO without waiting for his office to change. When you have all that going on, you have access to a lot of data. You have access to a market, a ready market for products, right? Now, the theme here is innovation for cancer, no? Our first board member is a president, immediate past president of Nigeria Cancer Society. We explained to him, he said, come up to me with a solution for cancer. We said we can do something for routine prevention. GiftShip provides that. Now, Nigeria Cancer Fund is very simple. When they're ready to roll out, we provide a portal and it's done, right? Why am I here? We're looking for enablers, we're looking for sponsors, we're looking for collaborators, right? Regulators, what do they stand to get? Expansion of enrollment. Many people will enroll quickly, fast. Then data and policy insights. We give it to you, evidence-based planning. And revenue generation. You get money. Funding and resources. You give us your money, you give us your expertise. So we need sponsors, investors, tech partners. What do you get? Social impact for your work, return on investment, exposure to emerging markets. There's less than 3 to 4% coverage in Nigeria. There's a huge market. And then market for people. We have pharmaceutical companies here. There's a ready market, predictable. Operational collaboration. Thank you. Thank you.
Well done. Well done. Always hard, especially when you're talking about a data product, to get the message across. So, bravo, bravo. That's very successful. I can remember the first time I did a pitch competition. I was so nervous, believe it or not. I fell off the stage because I've got very poor eyesight, and they put my slides on in front of me on a little monitor, and I couldn't see. And I also couldn't see at the end of the stage. So I just walked off, and I was off on the floor. Fell down, and luckily jumped up, finished my sentence, and jumped back on stage. Just because of probably nervous energy. So it's really hard work doing pitch sessions. So we've had 2. Are we enjoying it so far? Miriam, we're gonna switch it around. We're gonna go real in person first. Miriam and Zainab. Now then, what we're going to do, for those people who've forgotten, this is a pitch competition, and you are the audience. And at the end of 5 minutes, we're going to show our appreciation by giving them a very, very big round of applause. Do you have any slides? Wonderful. So, As you know, I'm a very generous timekeeper. You get a 5. Any sense of cheating, it goes down to 4. Okay. So I'm going to hand over to you. What I'm going to do, I'm going to give you a 2-second warning when I'm going to introduce, and I'll give you a 1 minute warning at the end. So, we're going to go. 3, 2, 1, go.
Ladies and gentlemen, my name is Zainab Sani Dahiru. I'm a medical doctor and a cancer advocate, and with me here is...
I'm Abolanle Mariam Ibinu. I am a final year student of Nile University of Nigeria, Computer Engineering.
It is no doubt that the burden of non-communicable disease is costing us lives and resources. There's an estimated 4 million Nigerians living with diabetes, and that number is rising fast, and it is rising in the younger generation. And despite that knowledge, poor food choices have been shown to correlate with poor glycemic control. Now, there's a study that has shown that up to 75% of type 2 diabetics have lack of adequate dietary knowledge. And the numbers are similar with cardiovascular diseases like hypertension, etc. The numbers are also not far for cancer patients, as up to 80% of cancer patients in low and middle income countries have been shown to be malnourished. Even though some simple dietary tweaks here and there could actually ease their symptoms and improve their survivorship experiences, cancer survivors can relate to this. Now, on the other side of the bag, healthcare workers are actually overstretched, and frankly speaking, they're actually ill-equipped with nutritional knowledge to pass down to patients. That's just how it is. It's not a local problem, it's actually a global problem. Now, nutritionists, unfortunately, are also scarce, and patients actually have to incur out-of-pocket cost to visit them when needed. And the truth is, for those of us who try to self-educate, we often find that the information is scattered all over the internet, and it is not tailored to our African and our Nigerian ingredients. It's tailored to Western food diets. I've been there before, as I lost both of my maternal grandparents to complications of diabetes. So I often feel the weight of guilt. Ladies and gentlemen, empowering people with chronic diseases through nutritional literacy should be a movement and a mindset. And to bridge this gap, we came up with the idea of Healthy Chow. Now, Healthy Chow is a nutritional literacy app for people living with non-communicable diseases, starting with diabetes, cardiovascular diseases, and cancer. And it offers locally tailored meal guides, meal planning guidance, and nutritional education modules personalized for food tips. We're looking for collaborators in tech, in finance, and advisors to help us deliver the minimum viable product. Thank you. My co-pitcher will take us through the interactive prototype.
So here I'll walk you through the app. So this is what you see when you try to log in. So for a user that hasn't made an account yet, you can easily sign up. Sorry. Yeah. And then here you see you have to put in your details, and then after that it asks a very important question of account type. That allows us to tailor the app experience to you, whether you're a patient, caregiver, or a healthcare worker. And for those that just have an account already, they can easily log in. Hello.
I can press pause.
Yeah,
Gonna
they
log
can.
in?
Yeah. Just
And
yeah. Here we have, as my co-pitcher had mentioned, this app will be tailored for people with the type of diseases you have. So this is the homepage of somebody that has type 2 diabetes, where the first thing they see when they log into the app is their charts for the week, and then after that you can select your symptom for the day. This allows the app to be able to give you insights. So okay, if you have dry mouth, you have articles on dry mouth, and then next thing you have the food suggestions you have for that day. Yeah, the food suggestions you have for that day will be able to cater for your problems. So here you can see the food app where you can select the category, whether you want for breakfast, lunch, dinner, or even snacks, and you can see some And you can see some recipes here where we have popular recipes, and also, yeah, so here you can see this is a local diet. This is a local meal here in Nigeria, so it's meant for people in Nigeria, where you can see the ingredients and the recipe. Please go back. Just get this home button. Down. Press home again. Excuse me. You please press home again. And this example of a page for someone with cancer, where on top they have their daily, their calendar, and they have their daily medicine requirements, they have their appointments, and they also can select their symptoms, just like somebody with diabetes. Please, down. Here we have somebody being able to search for articles or even food that they need based on their food library, foods that they've liked previously, or based on ingredients. Up here.
We pause, get pausing. Thank you very much. A big round of applause. Overcoming technical. I think that, I'm not biased. Before you go, hang on. I think that's one of the best, easy to see presentations I've seen all day. So congratulations, despite your technical stuff. Thank you very much. Okay, we're going to go online. Are we ready? Don't forget, the winners of this pitch competition will be appearing in our newsletter. Goes out to 30,000 people. Okay, while we're waiting, I'm going to ask some questions of our last speaker. Hang on, don't go. So, whilst we're waiting for these guys here. So, how do people find out more information? Do you have a web page that people can go on?
I could drop my email.
Yeah.
So they could contact me, because we've not uploaded the app yet. It's still in works.
Wonderful.
Yes.
Good. And it's going to be a continual work in progress as well, hopefully. So, are we ready with our online presentations? Yes? I'm getting a thumbs up. Umar, can you hear us?
Yes, I can hear you loud and clear. Can you hear me?
Yes, we can. Okay, Umar, here's what's going to run. We got 5 minutes. I'm going to give you a 3-second intro, okay? And when you're ready to go, we're going to hear you. Can we see Umar as well or not? Okay, for now, we're going to go with you online, and then we'll see some pictures very shortly. So, start your presentation in 3, 2, 1. Off you go.
Okay, please confirm if you can see my screen.
Yes, we can.
Okay, so 30% of doctors in Nigeria spend time writing medical record in the hospital. The fact is that they waste huge amount of time talking to patient, writing this very particular record. That is also a serious challenge, whereby it's difficult for the doctor to write and listen to the patient. Our solution, Volca Health AI, from voice to record, an instant, accurate, and local system that supports the doctor. How does it work? As the doctor attends to a patient, he starts the recording and he engages the patient. The application listens to the doctor and listens to the patient and transcribes the whole conversation. And the doctor has an instant result with bullet point regarding the medication, the technicality, and medical related terminologies. This very particular report also can be sent to the patient via WhatsApp, via email. Our business model is a B2B business model where we work with primary health providers and hospitals. The market size, there are more than 10,000 doctors in Nigeria and more than 50,000 primary health and hospitals in Nigeria. We believe this is a changing application for the doctor. Our traction so far, we're able to collect 10,000 data sets for Hausa language, 10,000 data set for Pidgin English, and also another 10,000 language for English language. We've created a machine learning model. We've tested our model with 98% accuracy. Our ask is $150 so that we can use this fund in fine-tuning our AI model for Nigerian accents, app development, field testing, and voice dataset expansion for local languages like Hausa, Igbo, and Yoruba, and also hiring AI engineers for 12 months. Ladies and gentlemen, we are giving the doctors and the clinic in Nigeria the power of instant voice-based documentation, faster record, better information, and time management to care for their patient. Join us as we support one doctor at a time. Thank you.
Thank you very much. And what a fantastic effort to finish, not just on time, but 2 minutes early. So well done. Congratulations, Umar. Very, very clear presentation. Like your style. Graphics are very good. Big round of applause for Umar. Thank you. Hopefully you can hear that. Wonderful. Do we have our next virtual presentation lined up? Engineer Mahmood, is that you?
Yes, I'm the one.
Okay, we're going to get you on screen and we're going to get going. I'm just going to give you a couple of seconds to get Mahmood's screen up, please.
Thank you.
Now then, while we're doing that, I'll tell you a funny story, because I can tell funny stories just like this. Don't worry, Mahmood, you'll be there in a minute. One of the times I did this, the microphone started making a loud noise. And then the sound system started making a loud noise. And then the computer started making a loud noise. And Andy starts to panic. So Andy then decides to pull the plug on the whole sound system. But unfortunately, because Andy didn't have his glasses on, Andy pulled the lights as well. So the whole room went dark. Not an uncommon theme. Okay, we can see Apexium. Mahmood?
Yeah.
Okay.
Good afternoon, esteemed panel of judges, respected doctors and medical practitioners, distinguished guests and all visitors present. It is a true honor to stand before you today at this important gathering dedicated to advancing the cancer care ecosystem. My name is Zakaria Uhuru Musa, and I'm here to present a solution that harnesses innovation and technology to address critical gaps in early cancer detection and long-term patient support. Despite advancement in cancer treatment, early detection remains one of the most significant challenges in the fight against cancer, especially in underserved regions. Today, we face a reality whereby 70% of Nigerian lung cancer patients are diagnosed at advanced stages, cited by WHO. Today we face a reality whereby delays in diagnosis due to lack of cancer awareness, false negative due to poor quality imaging when patients go for CT scans, and no system for long-term monitoring, and exactly standardized risk assessments are now available.
Yes, this is an approach. And before I show you the solution, I will show you how it is important.
Hang on, please. Mahmood, are you still there?
Yeah, I'm there.
Okay, so the other person, please mute your microphone. Please continue, Mahmood.
Yeah. So the existing approach is a patient has symptoms such as cough, and then go for a healthcare facility for a CT scan for his lung image scan, and then after that scan there is a false positive or no diagnosis and no follow-up or monitoring. So this is where our solution comes in. Our answer is simple, but yet powerful: a digital AI-powered system built for early detection, education, and long-term cancer care support. We are building a mobile-based platform that combines image-based cancer detection using open medical datasets that we've gotten, a personalized risk assessment tool, public awareness content, and a seamless link to telemedicine consultation, whereby users can schedule appointments with specialists. So the system works in this way. A patient gets his CT scan and then upload it to our platform. When it's got uploaded to our platform, our AI engine will scan that image and provide a recommendation whether that patient is vulnerable to lung cancer or has lung cancer. Next slide. So we leverage technology such as cloud-based infrastructure, machine learning algorithm, secure architecture for our users' privacy, and also cross-platform compatibility. You can use any platform for our software. Next. Our target market is high-risk adult and who are exposed to smoking. So we tend to collect and give them support in partnership with the Federal Ministry of Health and Project Pink Blue for community outreach. We tend to reach out to 500 plus primary healthcare across the country. Our business model, we have three types of business model: business to business, whereby hospitals and labs pay 50,000 per month for our AI scan interpretation. The premium model is patient tends to schedule consultation with specialists, paying 2,000 per month, and we aim to integrate ECHAlliance into because of nationwide rollout. Next. Funding requirements. For each solution to work, there must be funding. So we are asking for 7 million naira to bring this solution into life, because we only built the prototype, whereby the 40% of the funding will go for our AI model training, 20% for pilot deployment, 10% for team salaries and legal compliance, and then 30% for app development. This is our product demo. You can see the UI and the UX of the mobile app. Next. Please meet our team for this successful pitching, and thank you. Let's save lives together and detect lung cancer early. Thank you.
Thank you very much. Thank you very much. A very, very clear presentation, well delivered, and kept to time. So thank you very much. We all appreciate that. Very, very clear. Also a very clear business model. So well done. Thank you, Mahmoud. Okay, we're going to go straight on to another one. Have we got on to the next one ready? Wonderful. Come on, take the seats. This is yours. It belongs to you.
Very good evening, everyone. So very quickly, my name is John Amiaba. I'm the founder of the Mandated Empowerment Initiative, also the convener of the Association of Mental Health Reform Organizations in Africa. I will be making a very quick pitch that I titled Integrating Mental Health into Cancer Care. It is very important that we look into this very area where I believe every cancer patient or survivor needs mental health care intervention. Now, very quickly, I will just be speaking to this innovation to help increase the psycho-oncologists in Nigeria. You might be aware that, yes, there are WHO psycho-oncology programs that have been launched recently, but how many psycho-oncologists do we have in Nigeria? Are they? Can they be found? Can they be reached? Are they at the state level? Are they at the grassroots level, at the PHCs? Can we find them? So therefore, I want to pitch that there is the need to come up with capacity building that will be accessible, reachable to advocates, right? Not only medical practitioners, but advocates that can step in terms of tax shifting, tax sharing, to provide this psychoeducation for cancer patients. I will be speaking to 5-point agendas. So the first one is the reality behind diagnosis. Now in Nigeria, over 124,000 new cancer cases are reported annually, with thousands silently battling with just the physical toll of cancer. But unseen and untreated emotional, psychology, and spiritual wounds that accompany it are not attended to. Point number 2, the hidden crisis that we find in Nigeria. Psychological distress in cancer patients. More than 1 in every 3 cancer patients are experiencing clinical depression, anxiety, PTSD symptoms, and even suicidal ideation. It therefore behoves on us, everyone in this room, to support this innovation and this idea that we need deliberately and intentionally to integrate mental health care into cancer interventions. May I please again just quickly jump to the third point, which is why integration is non-negotiable. What we need is a shift, a paradigm shift from disease-centered care to person-centered healing. Why this is important is because we should be embedding mental health screening and counseling into every oncology clinic visit. Training oncologists, nurses, and healthcare workers in basic psychological first aid and trauma-informed care has become very, very urgent and non-negotiable. May I also mention that providing psychoeducation, peer support programs, and family counseling services alongside chemotherapy and radiation is very, very important. May I please conclude on this third point by saying that we must ensure cancer centers have access to clinical psychologists and mental health social workers, if truly we are looking at holistic care for cancer patients. Point number 4, it's about who we are at the Mandate Health Empowerment Initiative and our call to action. At Mandate Health Empowerment Initiative, we are already engaging in 13 member states with trained mental health volunteers and psychological and psychosocial responders, including in the IDP camps and undeserved communities. We stand ready to partner with cancer centers, government agencies, and CSOs to develop a national framework for mental health integration into cancer care. What we envision: national policy alignment between the National Mental Health Act 2021. We recently, in just a few moments ago, we had Senator Oloregbe here. Since the 8th National Assembly, our organization has been leading direct advocacy at the National Assembly, the judiciary and the executive, and at the grassroots level for the passage of the mental health bill. And we're very happy that our distinguished Senator Oloregbe, who just left here a while ago, single-handedly push for the passage of that bill, and we saw it come to the light of the day. And I want to tell you that that bill is not only for people who come down with mental illnesses or conditions or diseases, but then it is for a holistic healthcare in Nigeria. Let me.
Should we let him finish? Yeah, go on, finish it off.
Thank you very much. Yes, sir. Okay. My last words will be point number 5. Let me jump. Let's humanize the healing for cancer patients. Now, cancer doesn't just attack the body; it shakes the soul. So let us raise together to meet this challenge, not with fragmented care, but with integrated compassion. Distinguished ladies and gentlemen, the African proverb says that when the root is deep, there is no reason to fear the wind. Let's deepen our roots in terms of care for mental health for cancer patients. Let's ensure that we're all involved, and let's see how we can together transform the despair in integrity and treatment into true healing. Thank you very much.
Thank you very much. Well done. Well done. Good. Excellent. So we're going to move quickly on because we're running out of time. I want to introduce Miriam. If you're in the room, Miriam. Come and take the stage. Don't panic. Don't panic. Give her a big round of applause as she gets up. Okay. She's going to win a prize for funky earrings already. I've seen those. No, please. No, leave it. They're lovely. Funky means good. Okay. You've got 5 minutes.
Okay, sir. Thank you very much.
Do you have any slides? Sorry.
Yes, I do. Hello.
Slides for Miriam, please.
Good evening, everyone. My name is Mariam Oluwaseun Salami. I'm a breast cancer survivor. And cancer also turned me into an advocate. But beyond that, I think I wouldn't be here today if I didn't speak up. I broke the silence. I was in denial. I was silenced at a point in my life. And it broke me that a lot of women are still going through that. A lot of women don't want to speak because stigmatization, what the society will say. So I'm still in this journey. This is the 3rd year for me, but it doesn't stop me. Somehow it gave me purpose. Yes, so I started Miriam Atwande Cancer Support Foundation, and with the help of people, loved ones, and community, I said I want to give back to the society. So I'm breaking the silence around. No. Okay. Yeah. No. It's okay. You guys can see me during my treatment, and the silence almost took my life, and that same silence is taking a lot of women's life presently. So I started this NGO to break the silence, to make sure that no woman, no girl has to suffer because of lack of awareness or fear. That is what is common in our society. The fear doesn't allow people to, get treated on time. We believe that saving lives shouldn't just start in the hospital. It should start where people are, in the market, on WhatsApp group, in schools and in the streets. I was just 1 year into my treatment. I was doing chemotherapy, but I started going out to create awareness in schools. I move around. Like last month, we had a big awareness in the market last month, and we collaborated with 2 other NGOs, Okapi and Nest of Hope, with Silver Cross Hospital, and we did massively well. The thing is, people are asking for more, and I'm a survivor as well. I'm still in treatment, but I can't do it by myself. So the reason why I'm here today is to collaborate, to connect with people. We need more partners, we need more donors, we need volunteers, we need people to come together so that we can amplify our voices. You guys can see what we are doing. So my NGO, our thematic area is girls and women who are in denial and who believe that cancer doesn't exist. The thing is, cancer does. I'm a bit small, but the thing is, my voice is very loud. Cancer has given me a very loud one, and I'm using it. I'm using my voice. Thank you very much.
Another big round of applause, please. Fantastic. Finish on time. Fantastic. So we've got a John. John, do we have John in the room? John. John. I'll try and say it as many ways as I can. John. John's not here. No, John? We're going to move on to our next panel then.